Hi, everybody. My name is Shannon Riley. I'm the outreach manager for UCSD's Master of Advanced Studies in Clinical Research. Thank you all for coming. Really quick, I would just like to introduce the people who are here with us today. So Dr. Cuomo, would you like to go ahead?
Yes, I'm Dr. Cuomo. I'm a professor at the School of Medicine and one of the instructors for the clinical research program. I teach a variety of courses, and I'll be presenting a lot of the academic information to you today.
Perfect, thanks. Julie, would you like to go?
Sure, thanks. So my name is Julie Manarino. I'm the graduate coordinator for the Master of Advanced Studies in Clinical Research program. So if you join us next summer, I would be your contact person and your advisor throughout the duration of your studies. Nice to meet you all.
Great, perfect, thank you. And Ellie, would you like to go ahead?
Sure. Hi, everyone. My name is Ellie Farugi, and I'm one of the recent graduates of the program. And today I'm going to share some of my experience with you. Thank you.
Perfect. Thank you. Okay, so we're just letting one more person get in here. Perfect. And we're going to go right ahead. Dr. Cuomo.
Thank you again for coming. This is the information session for the MAS in Clinical Research at UCSD. So today I'll be talking about the Master of Advanced Studies degree in Clinical Research. So the reason it's called a Master of Advanced Studies as opposed to something like a Master of Science or another kind of master's is because it is a presentation of a broad variety of different skill sets. We're going to be teaching you a lot of different skills that are coordinated in order to enhance your expertise in something as broad and important as clinical research and to prepare you for careers in clinical research. So you will be acquiring and developing the skills and knowledge to conduct credible, patient-based research within stringent ethical and regulatory guidelines. So there are a wide variety of different backgrounds that our students have and that would be applicable to this program. For example, biomedical scientists, industry-based research professionals, physicians, dentists, pharmacists, other clinicians, academic research nurses, and international physicians. But the types of applicants that would be appealing to this program go beyond these categorizations, right? So if you have an interest in the biomedical sciences, an interest in doing research that helps people's lives, really this program, I think you'd be happy in this program. So the purpose of this degree is to prepare students for careers in clinical research, and in so doing, we teach you a variety of different clinical research skills, such as the ability to analyze and to understand clinical problems, including the relevant epidemiology, pathophysiology, right, the biology, and the current therapies available to treat, for example, a disease that has problematic epidemiology, right? To identify gaps in knowledge of the disease or its treatment, and after identifying those gaps, to be able to design a study, whether observational or interventional, that will allow you to fill the knowledge in those knowledge gaps in order to to catalyze better treatments, better diagnostic methods, more equitable distribution of treatments, and so forth, right? So in so doing, of course, we'll also teach you data management skills such as data quality assessment, working with databases and so forth. And we will teach you, the ethical principles of the regulatory guidelines, and of course, practical skills to enable you to perform well in a career in clinical research, whether in the private sector, academia, or elsewhere. So we have a variety of courses that we offer as part of this program, many of which are, some of which are required, and many of which are up to you to choose within certain categories. So examples of courses that are required, so these are listed here as core courses, are those which are required by the program and which you'll be taking early on in order to set you up with the fundamental skills required to do clinical research. So epidemiology 1 and 2 teaches you about how to understand epidemiological data, as well as to conduct epidemiological observational studies, such as cohort and case control studies, and how to do that in several different important medical fields. Patient-oriented research teaches you about how to conduct clinical trials, randomization, FDA guidelines, and so forth, relevant to patient-oriented research. Biostatistics 1 and 2 is a 2-part series that teaches you how to do statistical testing, how to do important tests to objectively determine whether or not differences exist, associations exist. So there is a 2-part required series of courses for biostatistics. Translational research fundamentals teaches you about how to get, bench to bedside, information at the bench, at the wet labs, biological information, to all the way to the bedside, to treatments that actually benefit people's lives and everything in between. Health services research teaches you about things like health equity, health economics, and health finance. And scientific communication skills teaches you about how to write research manuscripts, how to disseminate your science, the research findings that you get in presentations, written formats, and so forth. Data management teaches you how to work with data, right? So this is how to manage large databases, how to query databases, different types and structures of data, and ways of working with data. So these are the core courses. In the other courses, you have some degree of choice, right? So advanced statistics, you're going to be required to take 2 advanced statistics courses after having completed the biostatistics series. And here are 4 of those, right? Some are geared more toward clinicians, if you're a clinician. Some are applicable in a variety of different, a large variety of fields, biomedical and otherwise, such as advanced regression methods or longitudinal data analysis has applications outside of clinical research, and is widely popular. Experiential learning, many of these are geared toward translational research and learning more about how to get therapies from bench to bedside, as well as one in qualitative research. So if you want to work with focus groups, surveys, and with other qualitative information. The independent study project I will talk about in a couple slides, but that's the graduate seminar wherein you discuss the research that you'll be doing yourself, and we'll do that in an open seminar-based format. So I'll talk more about that shortly. The professional development, these are 2 courses which are required actually later on in the program. They teach you personal development, coaching, project management, and budgeting for your project. So these more practical skills for how to do a clinical research job. And of course, there are some general electives that we offer as well. You can do the comparative effectiveness research, where you compare the effectiveness and the cost effectiveness of different therapies, and in order to help organizations and just academically as well be able to determine the best therapies to pursue, to reimburse, and so forth. And then there's a directed studies offering as well. If you have a mentor that you find here at UCSD you really want to work with, you want to do a project with them, we can give you credit, general elective credit for that. So I also wanted to mention that if you choose the, so you'll all be required, it'll show up in the next slide, I think. You'll all be required to take the Translational Research Fundamentals course, but if as your experiential learning elective classes, you choose the 2 applied translational research courses, we will give you a concentration in translational research, right? So if you pursue the degree and you take these courses, you can say that you have a master's in clinical research with a concentration in translational science. And we also do offer these separately outside of the program as part of an independent certificate. So if you were interested, for example, in taking these courses before starting the program, that would be an option as well. So the independent study project, if you've started your application, you may have noticed that in your application, we ask you to define your research interests. What kind of clinical research interests you? Is it oncology? Is it health disparities? Is it health economics? what interests you. And the reason we do this is because we want to, on day one, work to set you up with a mentor if you don't have one already. So if you're interested in this project, there are a variety of faculty at UCSD that have volunteered to take one of our students under their wing who has forefront expertise in those subjects. And so we work to set you up with a mentor in order to do one of these projects, your own research project. If you are working outside of UCSD and you're interested in what you're doing for your job, it is perfectly fine with us, and we encourage it. If you want to do a project at your own place of work with a mentor, maybe a senior scientist where you work, that's fine on the programs, and we can facilitate that. At the end of the ISP process starts on day one. At the end of this process, whether you're in the 12-month track or in the longer tracks, you will do a traditional thesis defense. So throughout this process, you will be perhaps collecting data or using data that has been collected, analyzing these data using statistical methods, writing up a scientific manuscript, and at the end you will be doing a traditional thesis defense, an oral defense, as has been done for hundreds of years for master's degrees. You will be doing as well. And so this gives you the opportunity to do research that interests you and be supported by the program as you do that. So this degree teaches you a broad set of skills, rigorous and very marketable skills such as statistical analysis, data management, and so forth, FDA guidelines. And so there are a variety of different ways, career pathways that you can take this degree. So in the private sector, for example, working for a pharma company, you can get titles and do jobs such as clinical research managers, clinical data managers, and these are pretty desirable jobs, right? So they pay pretty well and they're pretty stable. The 2019 mean salary for a basket of titles that you can get in the private sector out of this degree was $97,000 nationally, and that is higher in California. And I'll note as well, a couple of years ago, San Diego was ranked among the top 50 metropolitan areas to be the #1 in terms of income growth. And in California, there was an 11% growth in life sciences jobs. So these jobs are increasing in availability. These skills are highly in demand, and they're compensated pretty well. So these are desirable positions, and San Diego is a desirable place to be for overall, but as well for this job, these jobs. I will state as well that that UCSD is ranked number 6 worldwide for education in the health sciences. So even if you don't want to stay in San Diego, a degree from UCSD, a master's degree in UCSD from UCSD in clinical research has broad appeal, and you can take that wherever, and it is marketable, certainly outside of UCSD, outside of San Diego. If you want to stay in academia as well, UCSD is a recognized name. You can take this to another university, or you can stay within UCSD. UCSD is number 5 nationwide for research funding. In 2018, we received over $1 billion in research funding, and we were one of the top 10 institutions for receiving NIH funding. It's $180 million in 383 separate funding awards in 2018. So UCSD is the place to be if you want to learn, if you want to be involved in biomedical research, and San Diego is the place to be if you, are interested in the private sector clinical research as well. So these are all titles that our alumni have, so at various different levels. So directly out of the program, you can get a title such as Global Trial Manager, International Clinical Project Manager, Clinical Trial Manager, Clinical Research Scientist. These are all examples of titles that you would get in the private sector directly out of a master's degree. And our alumni have, over time, moved up the ladder in the private sector to get titles such as Director of Clinical Operations, Director of Clinical Research, and Vice President of Clinical Research. So you can get these in-demand jobs and move up the ladder as our alumni have done. And speaking of alumni, we have one of our recent alumni joining us today who is going to talk about her experience in the program. So Ellie, go ahead.
Thank you so much, Dr. Como. Hi, everyone. My name is Ellie Farugi. I'm one of the recent graduates of the program, and I'm here today to share my experience as a student and as a graduate of this program. Just a little bit of background about myself. I'm an international medical graduate with some experience in research, public health, and healthcare administration, but I had no prior structured or comprehensive training in clinical research before I attended this program. I chose this program for different reasons. First, I believe that the program's approach, its curriculum and course contents would provide the students with the opportunity to acquire the necessary knowledge base, skills, and core competencies in order to be successful in the field of clinical research. It seemed to me that the program would offer the students with the opportunity to not only learn the theoretical concepts, but also develop the practical skills that they would use in real life situations. And I really like the idea of mentored research experience that the program offers. And the second reason was that I believe that the format of this program would allow the students to individualize their learning track by basically choosing the elective courses which might be more appropriate based on their future career goals. For example, if you want to do a concentration in translational research, you would take the appropriate courses that Dr. Como mentioned. If you want to focus more, for example, in health services research, you do more courses like qualitative research or comparative effectiveness research, and etc. So basically, this program allows you to make your training tailor-made based on your individual needs and preferences. The third reason for me was that the program seemed to offer a collaborative educational environment in which you could interact with wide range of individuals, from talented students with diverse educational backgrounds to successful industry professionals and impeccable faculty. And that was a very important factor for me. And the last reason was that the program would offer the flexibility that the program would offer in terms of a pace of study. What I liked most about this program, in addition to doing the concentration in translational research, one of my favorite parts was doing the independent study project or ISP by taking the courses in the format of seminar, as Dr. Como mentioned, and also by taking on a mentored research experience. So I learned to do a well-structured literature review, design and implement a well-designed clinical research, and analyze the data, interpret the results, write a scientific manuscript, and present the findings in the most efficient way, which gave me the opportunity to be chosen to be among those who presented in the first annual clinical research symposium. And I also learned that to develop and present a scientific poster for that symposium. Presenting my ISP in the symposium was a real life experience, which I can say confidently that the program prepared me for, and I'm really grateful for the opportunity. The other thing that I liked about the program was that I appreciated the fact that the program's emphasis on having open channels of communication with the students and their willingness to make improvements if necessary. We had student representatives and town halls throughout our training to provide feedback to the program, to the faculty. And I also appreciate the fact that there was continuous effort to develop new and innovative courses like translational research, which was a really important thing for me individually. And it was developed throughout my training the past 2 years. So all of those things were really important in terms of flexibility of the program. The other thing that I liked about the program was that the opportunity for networking and making contacts with academic and industry professional and guest speakers throughout different courses. And the last but not the least is the amazing support that you will receive as at all levels. In this program, as a student, you really matter. Your success is everyone's goal. And you can count on support from outstanding and amazing dedicated faculty, to your mentor, to the coordination team, Julie here, whom I've known only remotely till today and virtually now, all the way to Dr. Como, who's been exceptional. And I'm so grateful for all his support. You basically, he's one of the greatest assets of this program. You can count on him for support for about almost everything. Sorry, Dr. Como, I put you in.
Thank you.
And also all the way to Shannon Riley, who is our career advisor and outreach manager, and who's been amazing. So for example, now that I'm a graduate, I look back, for example, what, and Shannon helped us by developing throughout the training, my training. Shannon, for example, developed a list of the biotech and pharmaceutical partners who we could explore internship opportunities with. She would share with us and inform us of any career fair or job opportunities or additional professional development courses that might come up on top of what the program offers. She also helped me personally to develop a better resume and cover letter and just highlight my skills and abilities better to just reflect it when I want to apply for the jobs. She has also helped us alumni to keep them in the loop by having networking events and also using professional platforms like LinkedIn. So I'm grateful to her support as well. Now that I've completed this program, I'm hoping to be able to use the acquired knowledge and skills that I've been, to enter the field, actually to start a career which I have been preparing for. I will continue to build more, kind of like extend my network and do more networking while I'm working with my mentor to do publication on the extended version of my ISP. In conclusion, I just want to tell you, if you decide to choose this program, you will be in great hands. The rest is up to you. I wish you all great success. Thank you so much for allowing me to share my experience with you, which brought us a lot of good memories, which I had in this program. I'm happy to answer any of your questions at the end of the presentation. And with that, I hand it over to Julie. Thank you.
Thank you so much, Ellie. That was great. So here are some important details for those of you who are interested in applying. Overall, the program cost is about $34,000. We require 40 units total. It's $800 per unit, which is about $32,000 for a 12-month pace of study, plus registration fees for a total, again, of $34,000. Now, be aware that we do offer a 12, 18, or 24-month pace of study option. So if you study for 2 years instead of 1, the cost will be a little bit more, again, for the quarterly registration fees. So a good thing about this program is we know that a lot of you are working and may not be able to finish it in a year. A 12-month pace would average about 4 to 6 courses per quarter, which is a pretty heavy load. If you prefer an 18-month pace of study, you would have that option. That would be on average about 3 to 4 courses per quarter. And then finally, we have the 24-month option, which would be about 2 to 3 courses per quarter. All of our courses are in the late afternoon, early evening, from about 2 p.m. until 8 p.m., somewhere within that time frame, again, to accommodate most of you who are working full-time. And so we do have that flexibility. If you decide you would like to change your pace of study, say you start out and you think you're going to commit to a 12-month pace of study, and then you realize maybe you need to take a step back, take fewer classes, and you want to switch to 24 months, that's certainly a possibility. I can support you with that and help you rework your plan to make sure that you'll fulfill all of the requirements to graduate, you know, whenever you are anticipating to finish the program. And we currently have the application open, and you can apply at any time. If you are an international student, we encourage you to submit it as soon as possible. And otherwise, our application every year closes out at the end of January, and it tends to open in September. So right now is the time to apply. And the next slide will go over the application requirements. So we do require a bachelor's degree from an accredited institution, and we require a minimum GPA of 3.0. We would like you to have 2 to 3 years of professional work experience, or if you have an advanced degree, that would be a substitution for that requirement. You will need to submit a statement of purpose. Within that statement, you would include a description of your individual strengths and interests and how the program will benefit you professionally. You will submit your resume when you fill out the application. If you are an international applicant, you need to take the TOEFL or the IELTS, and you need to submit that score. For the TOEFL, we require a minimum of 85. And for the IELTS, we require a minimum score of 7.0 overall. We require 3 letters of recommendation. And then finally, we do not require the GRE or GMAT, which is nice. It's one less thing that you need to worry about. So here is my email address. It's clre@ucsd.edu. I manage that inbox, so please email that if you have any questions that we don't get to cover today. I encourage you to visit our website, clre.ucsd.edu, also on this slide. Anything that we cover today probably is on our website, if not in more detail, so please check that out. And if you are interested in the certificate course as opposed to the master's course, which Dr. Cuomo talked about, please see this email address as well as this website for reference, and you can see more information about that or receive more information by emailing. Thank you very much.